If you're dealing with joint pain but want to avoid surgery, well, there's a treatment option gaining attention for its natural healing approach. It's called stem cell injection therapy, and it's being used as a non-operative alternative to help patients heal from within. Joining me this afternoon is Dr. Tuvi Mendel from QC Orthopedic Specialists. Doctor, welcome back. Thank you for being here today.
Thank you.
Well, you were just telling me there's just a whole lot of interest in this right now. So let's start with the basics. What exactly is stem cell injection therapy? How does it all work?
So there's been a lot of interest in stem cells. Patients ask questions. You see it on the news where athletes get injections for injuries. And basically there's a variety of different ways to do stem cells. There's PRP, which stands for platelet-rich plasma, and there's stem cells. And I wanted to briefly educate the public a little bit about what it is and what are the options or what is it used for. Basically, PRP, which is fairly commonly used, stands for platelet-rich plasma, which basically means you harvest some blood from the person itself, you centrifuge it, and you get about 3 cc's of concentrated platelets. The platelets, as you can imagine, when you cut yourself, they bring in a lot of response, immediate inflammatory and growth potentials and growth factors to try and heal. Whereas stem cells is where you actually take the stem cells out of the bone marrow and use that to basically inject into either a joint, a diseased joint, or a tendon or a ligament or something that you want to potentially accelerate the healing. Could also be used in combination of surgery. Frequently, at the time of surgery, you can inject stem cells or PRP to try and accentuate the healing.
And kind of accelerate that process a little bit. Wow, that's amazing. How far we've come, truly. So what kinds of conditions and things like that can be treated with stem cell injection therapy?
So traditionally, patients who have a little bit of arthritis in the knee or the shoulders or even the hip or the ankle, you could potentially inject either stem cells, which basically tends to regenerate the tissue. They're kind of blank cells that can differentiate into whatever it is you need them to differentiate into. Or you can also inject some PRP, which also provides for local growth factors and some stem cells to try and help healing. But traditionally for orthopedics, it's mainly used for joints, ligaments, and tendons.
Okay, and typically not anything else other than that?
For us, no.
For you, no. Okay. So tell us a little bit about the process. You know, for folks questioning it right now, going, this might be for me, how much downtime is there at the actual appointment, the procedure? Roughly how long does that part take?
So the PRP part is fairly simple. You just come into the clinic, you get your blood drawn, you centrifuge, you get about 80 cc's of blood, you get about 3 cc's of PRP. That's done on the spot, and you basically inject it into whatever location you want to inject it to. There's really no downtime or any risks involved. The only thing is that usually you don't take any anti-inflammatories for about 2 weeks because it negates the function. Stem cells are a little bit more involved. Takes a little bit longer, a little bit more painful, and a lot more expensive. So PRP is fairly is reasonably, payment-wise, but stem cells tend to be more expensive because it's a much more involved process.
Okay, and a little more painful, but you know, how is somebody who's watching right now know the difference if they're trying to make a decision between doing something like this or going kind of the more traditional route as far as treatment is concerned, which oftentimes may entail something surgical? How do they know what's right for them?
So usually with either one, stem cells could potentially give you a little bit longer lasting results. PRP, traditionally, I get pretty good response for about a year, and sometimes you have to repeat it. It's not designed to completely reverse the entire process. So if your process is advanced, if you have a lot of arthritis, sometimes there's not as much power in order for them to be able to fix that. But for a little bit of minor arthritis, if you want to delay the need for, let's say, knee replacements or things of that nature, you could potentially consider that and you might get some relief.
Okay, and then so at this point we're potentially delaying the inevitable for a lot of folks, a lot of patients, and I think that's good to know. Is this typically a one-time treatment, or will they have to continue to come back and get this stem cell injections?
So if they get a good response, like I said, PRP usually about a year. Stem cells maybe a little bit longer if they get a response. And like I said, sometimes at the time of surgery, we incorporate that when we do ligament repair and things of that nature to try and stimulate much quicker healing. So it really depends on how much relief you get from it. If you get good relief, then it might not be a bad idea to try it again. But if your process is too far advanced, then maybe go ahead with surgery.
Maybe have to go back and figure out what to do next. Okay, well, to learn more about stem cell injections or really any other services at QC Orthopedic Specialists, visit osquadcities.com. That website is right there on your screen. Dr. Tuvie Mendel, thank you so much for being here today and just laying it all out for us. We appreciate it.
Anytime.